Okay, well, welcome to I think it's March. Where does time go? March 18th, day after St. Patrick's Day. I hope you all had a nice weekend. Our last time together, we provided an overview of formative and summative assessment, and this time we invited folks to bring examples of assignments that they wanted to share, or any developing ideas and times to ponder. We're acknowledging that we don't have all the answers, but we're learning and growing together. And I think Nancy will affirm that when we were at AACN in December, it was really clear they don't have all the answers either, and they're continuing to learn along with us. So we will continue on our journey today, and I just want to open it up and see if anybody has any questions or exemplars that they'd like to share or ponder. Well, I have a additional insight that I discovered over the last few days that I'm happy to share. It's to get us started. I can share my screen. I added a few slides to a project or a presentation I'm doing in a few weeks at the California Association of College of Nursing. But when I was reading in the Handbook of Caring Science, Marlene Smith, who is the former dean of Florida Atlantic in Boca Raton, they have a caring science curriculum there. And I didn't realize that in this book, her book chapter from 2019, she talks about the difference between subjectives and objectives. And we talked last time about subjectives and objectives and how we focus everything on objectives, and yet formative learning is really subjective, is very subjective. And it kind of reminds me of when I was in graduate school, we utilized Donna Bedian's work, and we talked about structure, process, and outcome. Remember that framework? Well, the subjective is the process, right? It's how we get there. And so subjective learning is the formative learning. It's the formation, and that's so essential. And yet we just focus everything on the outcome, right? Which is the competency. So what Smith talks about is to deepen our understanding of subjective learning. And she talks about, for them at FAU, subjectives are defined as the formative becoming of the student as a caring nurse, the formative becoming, and that fits so well with Tim Godfrey's work on the formation of the nurse. And then they base here, I will share this full screen here. Okay, and then if you go across, they based the subjective learning on Roach's 6 C's, which are compassion, confidence, commitment, comportment, which is behavior, conscience, and then finally competency. So,
Sarah, we're not seeing what you're saying.
Oh, you're not?
No. Or maybe I'm the only one.
I will.
I don't. We saw the deal assignment from your Canvas site.
No, yeah, I shouldn't.
Okay.
Here.
Okay.
We better start this over. Okay. Can you see that now?
Yes.
Yes.
Okay. So at Florida Atlantic, they talk about subjectives are the formative becoming of the student as a nurse. So it's the formation of the nurse. And that they base subjectives on Roach's 6 C's of compassion, confidence, commitment, comportment, consciousness, and finally competency. And then objectives for them are content or competency-based are clustered under relative subjectives. So the outcomes, and I always remember in my graduate psych nursing course, we're always told if you take care of the process, the outcomes take care of themselves. And I think this sort of fits along that line of thinking. And so this is this structure is used at Florida Atlantic University because it emphasizes for them the centrality of caring. So the next slide, they give examples of course subjectives with objectives. And you can see Roach's, these examples have, they have the example of 2 of the 6 C's. The first one is about becoming competent. And here's examples of how they language that. They say use SBAR communication to provide a complete, organized report, collaborating nurses report to collaborate nurses. To collaborate, I got some language wrong there, to collaborate nurses and other health professionals that reflects knowing of the whole person. And so they use SBAR to integrate into their interview process, but the goal is that they've demonstrated that they're knowing the whole person. And I love that because it really combines the objective with the subjective. They're talking about using a tool, which is often really important for students to be able to use specific tools, but not in a way that they're scripting or they sound like they're scripting with patients, with the overall goal of being that you're demonstrating that you know and understand the whole person. And then the second one is demonstrate assessment and skill and safe dosage calculation and medication administration. So you can see the use of the emphasis there on the subjective, where the objective is the ultimate outcome, but the subjective is used as the formation of the nurse to get there. And then the second example they provided is becoming compassionate. Oops. And in that one, they, the subjective is listen to a story of an older adult's health experience to understand and respond to calls for nursing. And then the second one is to use touch appropriately to convey presence and understanding. So this is how they've, they use a specific model, but emphasize subjectives as the formation to get to the objectives, which is the outcome. So that was,
and it's almost like they've kind of defined, you know, how we've been talking about progressive indicators, like how do we actually measure, you know, whether someone is able to provide, you know, compassionate care or use the ways of knowing. It's like you could even use this as evidence or ways of demonstrating that the person's actually doing what they've been taught, you know, and that's I know I'm jumping ahead, but that's the next phase of what we talked about as well, that once we develop these courses, assessment's going to be important, and having a clearer understanding of what it is that we're want to be seeing as the person being able to acclimate and put it into practice is important. So that's another, you know, benefit of looking at objectives and subjective approaches, I think.
yeah, yeah. There's so many layers to this. So Francine, I understand how you were getting a little bit mixed up and confused, because it's easy to do because we're trying to juggle all of these things at once. We're trying to juggle the domains, the competencies, and the sub-competencies. We're trying to juggle that with module and course learning and program learning outcomes. And we're juggling that with formative and summative assessments. So we're it's a complex matrix of materials that I think once it comes together, it makes sense. But when you're in the middle of it, in the process of it, it can be somewhat confusing. Any other thoughts on formative and summative assessment? Nancy and I talked the other day, we were talking about, you know, are there summative assessments throughout the semester, or do we just have summative assessments? I mean, yeah, summative assessments at the end of the semester. And I don't know if those of you who've begun to map your courses, if you're finding that you have summative assessments throughout your semester, or are they mainly coming up at the end of the semester, and are you identifying mainly formative assessments, and are you struggling with labeling them, whether they're formative or summative?
You know, I I go back and forth between those two columns, and in my mind, right or wrong, I have categorized the assignments, the deliverables, as formative. Something that you can grade, you can respond to. Not, and this is different than BSN and some MSN, in that in the DMP, it's almost all online. So when you're teaching in the MSN in class, I mean, you can make summative assessments as you're going along every time you teach.
I think you're mixing them up. I think you're mixing formative and summative up. Summative is the very end.
Oh, I did. I absolutely did when I just said that. Yes. Thank you, Sarah. Yes.
Yeah. Mm-hmm.
So yeah, the formative, you know, like it's in class discussion, getting feedback from staff, you know. So, and the summative, then I have thought, okay, these are the assignments that will be graded. They're going to have to hand in, or they're going to have to do a presentation or something. Mm-hmm. Am I off base? I'm trying to, because I'm creating two new courses.
I mean, I think I've struggled with it a bit too, and I think it sort of depends on the situation. I mean, there are formative assessments that I do in the classroom that lead to a scaffold to the student then being able to complete a specific assignment that's also a building block to the final end product, usually, which is a presentation and a paper. So I'm kind of going back and forth too. It's like we keep saying it's sort of like you're thinking on multiple levels. So, I mean, I have an example I could kind of show that shows my dilemma, and I'd love to get some feedback from everybody and see what you guys think.
That'd be great. Hi, Susan. Welcome.
But where is it? Shoot. Okay, well, keep talking and I'll try to find it. I thought I downloaded it, but I didn't.
Yeah, and I'm finding now, Francine, I do grade formative assessments. I'm not just grading summative assessments. So like discussions, they complete the discussions, that's formative. I count that as formative and I give a grade. And then a lot of the papers in the master's program are scaffolded. I need to work on my language, but I grade the ones as they're building. I grade those as formative, and then the final paper is summative. Is how I've been doing it. But again, I don't know if it's something that's really one way. I think it's a gray area, and it's why that's so important that we talk about and that we be able to articulate why we've chosen to label something as formative and why we've chosen to label something as summative. I don't think that there's one right answer. I think there can be multiple right answers, but we probably need to be able to have a rationale for why we've chosen a particular approach. Anne, what do you think?
I'm learning that some things now have a terminology, and I think I was just winging it. So for the example that you showed in the PowerPoint, my med-surg students do a SBAR to report, but I just thought it's a SBAR. They're going to need it. They're going to need to learn it. I never connected it to summative and formative, or
Yeah.
I just thought, nurses use S-bar, so there's a project on using S-bar. So now I have a name for it.
Yeah. Yeah.
Mhm.
Um, but also, I think, and maybe it's because my student population might be a little different. We're I'm more pre-licensure.
Hmm.
So the idea that there is a grade for subjective information is, and I stand corrected on this, is very for lack of better words, for this student population, it's very enticing. So there's a trophy to discuss. There's a trophy to talk about something that should be talked about anyway. But for MSN prepared nurse who's already been a nurse, I think it's different because they already have the mindset of a leader and all of that versus trying to mold um my pre-licensure nurses or nursing students. So I'm not sure how this will play in there. But for the MEMSN students and the BSN students, I'm not sure how I can tie that in while also not making everything about a grade. Because when they
Mhm.
do get into nursing, sometimes you don't get a thank you for the job that you're doing.
Mhm.
Um, and
Well,
I'm trying to find ways to help them learn that.
yeah.
So how I'm not sure how that was my confusion. That was the wheel turning in my head.
Yeah.
Well, here's an example that I could share that kind of ex elaborates on what we're talking about. So this is an EBP course, and I have the student, and this is pre-licensure as you're just talking about. And so I have I have the students, and this is kind of the course description, and then it's a project-based learning course. So the students go into, they're given scenarios, they choose an evidence-based practice project um, um, issue, and there's a bunch of different scenarios that they can choose from, and they work in a team all throughout the semester. And so here's an example of, from my perspective, so the essentials of competencies that I'm addressing in this particular first module are integrating nursing knowledge, et cetera, and then engaging in a guided spontaneous reflection of one's practice. And so I've considered this a formative assessment where they have a group discussion and they talk about 5 patterns of knowing from Chin and Kramer. And then they reflect on a recent professional experience that they've had where they had to use multiple ways of knowing. I didn't consider that. I don't grade that. It's part of a discussion that we have in the classroom. It's kind of, and so I felt that that was formative. Now we move down to the second one where, again, they're applying principles of team dynamics, and they're again integrating nursing knowledge. And this is more focused on the project team work. So they work in a team. I give them so they have objectives that they're supposed, or outcomes they're supposed to achieve at each meeting. I give them an agenda that has, very clear directions. And then I started thinking about what's the outcome from that? Why is that even important? And that's where I came up with maybe, so these are the things that have to happen at the end of the meeting. They have to identify specific roles. They have to have a team leader that facilitates the discussion. And then they have to report back to the whole class after, just sort of talk about their discussion and what they've learned and how they've used ways of knowing again. And I put it in the summative column at first because it seemed like, again, thinking that, well, they've done this formative experience and this is what the outcome should be. And then I titled it progression indicators because I wasn't sure how I felt about it, but I wanted some way to be able to define what did I mean by achieving or mastering the subcompetencies that are on the far left column. So that's That's another example just for people to give me feedback about. And then the third example is where they're actually getting into understanding the different components or elements of the research project. So they did a think, pair, share activity, and they were given 2 quantitative studies, and they have a tool, this anatomy of a research article tool, and they were supposed to independently fill it out first and then talk together and compare notes, etc. And the summative assignment is actually handing this their own individual anatomy of a research article paper. It's a tool actually back in, and they get graded on that they've completed it. So that's where I kind of didn't feel like most of my formative assessments were graded activities because of the nature of this course. Because again, here's another example, evaluate clinical practices to generate or improve care. They're in their simulation activity. They're in the library with the librarian looking on developing their PICO question. And again, they have a tool that they have to complete. So I considered that to be a formative, a summative assessment. But all of the summative assessments that are in this far right column are leading up to actually the final summative, which is a paper and a team project presentation. So I'm not sure, how that fits or how people,
Nancy, I just had a thought, and I mean, for all of us to ponder together is in my mind, when you were saying that, I thought, well, if a learning activity meets an entire course learning outcome, could that make it summative? Whereas if it meets only a part of a course learning outcome or a piece of something, that it might be more formative, like a partial towards the whole.
Yeah, that's what I was thinking about in terms of how we slice the pie.
Right.
Are we looking at? I guess I look at the summative at the end to be okay. That encompasses all of the CLOs that are identified for that course. That using backward design. So that's why the last 2 assignments are sort of structured that way. So that to me is very clearly a summative. But then when you think about scaffolding and building competency, that it's not a linear process, that there's a number of different building blocks that go, and that's how this course is designed. It's all designed so that by the end of the semester, the students can accomplish those final, learning outcomes. So, does a formative assessment learning activity relate to, these? It's probably not. I mean, I don't know that it matters really.
Right. I in
really
my mind, I was thinking the way I might justify it is if a learning activity meets an entire course learning outcome, and not all of them, but just one, then that's to me in my mind that could be summative because it meets the whole learning outcome. Whereas
if you look at it by a module, this is how I was looking at it, module by module. I want, it's scaffolded learning. So by the end of this one that's showing up here, by the end of this module, I want them to be able to, have a PCOT question identified and have done 2 critiques. That's not totally summative, but it's sort of summative.
Yeah.
It's summative of the module. So I guess maybe we're working towards, does summative mean the whole course, or does summative mean a building block kind of concept?
For me, summative would mean one course learning outcome. Yeah. But it would be something as a whole. I don't know if it'd be a whole course. I mean, if it was a whole course, then it would probably only be the things at the end of the semester. The presentations and the final papers. If it was a complete, but then could it be summative? Like you've identified some of these along the way as summative. My question is, do those meet like one whole course learning outcome?
Yeah, and I mean, I think what I, in my mind, I've kind of tried to build each module to some sort of an outcome.
Mhm.
And so thinking sequentially how people learn, they're in a simulation activity, or you're covering different content, or you're covering content, then they're applying it. They're applying it to be able to do this element of the final. So I mean, I don't know.
Yeah.
It's almost like I needed another column because I wouldn't know how to separate them unless you just say that none of the simulation or group work belongs in the formative. And I disagree with that. I think that's a huge,
I think
that
that's a lot of
activity.
formative. Yeah.
Yeah, that's how they get to being able to, finish
Yeah.
what's in the far right-hand column.
Yeah.
So,
Yeah. Well, thank you. This is, I like this table, how you put it together and really organized your thinking. And I think that's key that we show that we've thought about this and that we can explain it in a way that makes sense.
I have a question.
I haven't seen it. Excuse me. Go ahead.
No, go ahead, Nancy, then I'll ask my
I
question.
haven't seen anything definitive coming out from the essentials group anyway, defining more clearly the formative and summative assessments in terms of should you only have one, or can you have multiple ones and such. So that could be a question that I can pose, because we should probably, if there's going to be more definitive answers to those questions, we should know that so
We
that
need
we
to
don't
find out. Yeah.
rework and frustrate people.
Yeah. Yeah. If you could take that back to the
I will.
essentials group, that's awesome question. Francine?
So we're doing this, and then, so in my case, and in all of our cases, not just my case, so I'm developing 2 new courses, and they're not brand new. They're combinations of courses. And doing this, which is good, and Sarah and Nancy and Susan, it reminds me of what we did with the MSN, but we built them into the Canvas shells. We put the formative and summative information in the Canvas shells. We're doing this on a separate sheet. Why, I guess my question. I mean, I'm doing it, I'm kind of going along, but I'm thinking, okay, who's going to use this? Because if I'm teaching a course, I want to see a Canvas shell, like a master Canvas shell that I can use. I don't know if I'd go back to a sheet like this. So how are we going to use these sheets in the future, I guess? Our mapping.
They're going to be the basis for how we build the Canvas shells.
Okay, that's what I'm thinking. Okay,
Yeah,
so
yeah.
it's another step where I was thinking, okay, when we built those Canvas shells way back in 19 or whatever we did, and 20, we just put them right in there. We put all this information, we put the CLOs and the MLOs, and we connected everything. We did it right in the shells, right? So this is just going to be an intermediary step that then that populates the Canvas. Now there's going to be more stuff in the Canvas.
I think that the difference and the advantage of this, as opposed to what we did, is that we kind of took it up for granted, or we took it on faith that everyone was going to develop learning activities for each active learning. Remember, it was a whole process. We had gone through several revisions. When the second time we went through all the courses, we said, well, wait a minute, do we have active learning activities, et cetera? And we changed a lot of what we put into the Canvas course. This will help us to do it right the first time, I think. And then secondly, the other major advantage is that, like we've been saying, these maps are going to be fed into the core system, which will be able to pull out a lot of data for us, and also serve to be kind of the repository of any information we have to be able to demonstrate to anybody that's asking about how we developed our courses, meaning CCNE and everybody.
And you've told me that before. Thanks. I just wanted to validate why we are doing, and it's helpful because I'm now going to move some of this stuff, but much more information, because the actual assignments will be in the Canvas shell, but I'm moving some of this into the Canvas shell. Okay, thank you. I just want knew the steps.
No, the whole,
Oh.
well, this is, remember this mapping tool came from Angie, from ETS. And she's the primary person that kind of helps us to make sure that our courses are set up, you know,
Uh-huh.
with all the
Yeah.
universal design characteristics, et cetera. And at first I thought it was kind of a bit overwhelming, but the more I work with it, it keeps me honest, you know.
Right,
Makes me-
yes. Thank you. Thanks.
Mary Lou, you have a question?
I just had a comment
Comment?
because I thought the same as Francine at one time. But I
Mhm.
think if one person develops, if I have a template, if I have the recipe, to be honest with you, a formative evaluation, I can do anything. That's how we wrote all with all the CNL classes, how they were built on each other. And the outcome was at the final what project we wanted them to work on and why it was important. But the whole thing is where I want to see our BSN is, can we not do that same thing with some type of evaluation like this? Because each little segment, like we had our students at the master's level building all along so that and they were getting hours for it in their community. They were getting checklists of all the things that we had done based on all of it. And they had their final paper, which we at the senior level have a final paper, but it's a conglomerate of what happened when you were junior ones, if we still leave research at that department, or what happened in the community to change your focus so that you will be different. So as a freshman, when we start you, let's say at Red Cross, like doing some volunteer work there, or you're doing stuff for American Cancer, what's changing you each time so you could bring that along? So the formative, but also having the students. I guess the thing I'm having a hard time is if indeed the student has to allow for competencies so that we're not going to have the same kind of grading that we have right now. And the competencies are going to have to show more. And the faculty are going to have to work together more. Like the team will have to work together so that everybody's on that same page. Just sort of like what we did for the CNL. I mean, I was lucky to have that depth of experience for many, many years. And I think it's made me a better teacher because I can see the formative and summative. But I think the formative, it's sort of like it's getting the blueprint of the classes. Like if I was doing a new kitchen, this is my blueprint of what I want. Can I change it? Yeah. If I want to put the refrigerator a different place, yeah, I can do it later. But as long as we're on the same page, I think, like Francine, I feel in a way bad that you're writing classes now all over again. So that isn't there something that we've done right that you don't have to do that?
Well, no, I'm using information from other courses and then looking at the ascent, some of it has to be rebuilt, Mary Lou, and like in anything, it has to be updated. So what we're doing is we're moving stuff from one course into another course.
Yeah,
and then
that's
we're
true.
creating a new, we're creating a new, yes, we are creating a new DMP leadership course. I will tell you that.
Yeah.
We're looking at what we did and then we're taking out
making
some
it better.
parts that
Right.
work. Yeah.
Well, it's a different nurse. Maybe we're a different nurse than we used to be 5 years ago, 4 years ago, 3 years ago. I'd actually say 2 years ago right now. Yeah, I kind of agree with that. So I don't want, like, I myself don't want to be writing a class that's going to change. Like if I was writing a new class right now, I would like to keep it the same until we do a big revamp. Like, if Nancy, let's use yours as an example, you've done like a little formative evaluation in some respects now for the evidence-based practice. If indeed this is the way it would work, why can't we start to do this soon and start writing that up as a template? So we could help you to do that, or you.
Well, yeah, we could. I've kind of done a map to it already. So,
and if this is a new way that we want to do it. So I didn't mean to interject for so much. I was thinking, gosh, that it's a good thing. I feel glad to have seen that template. You will be able to share that template with us later, the one that you had out, because I looked at it just really briefly.
Sure.
Okay. Sorry.
It's a work in progress though. Yeah. I think the thing that, and I probably have to do some more. We want to be accurate in our terminology, formative and summative. But I think, and feels a little still nebulous to me yet, because there's so much discussion about building learning and that students need to progress along a trajectory of moving from simple to complex concepts, and how important it is to build a sense of mastery and efficacy for students all the way along the line, which is why, we don't just anymore, just do a big, huge final at the end of the semester that's 100 points, and then the person fails the course. I mean, we're really trying to move away from that, because that's not competency-based education. So when we talk again about what's a formative and what's a summative assessment, I think conceptually, in my mind, it's always formative is always helping, is the building block to lead to the mastery of something. And maybe that something is one big event at the end of the semester, or maybe it's a series of progressive competencies that you master that allow you to become able to do the final semester, which in this particular course is kind of the way it is. You can't just say to people, okay, put together an evidence-based practice project, and not have a lot of steps of building along the way, because they have to learn about research first, and they have to learn about EBP. Then you have to bring in
but we have to be doing that. Like, I want all of my students to be do it in clinical. We're doing evidence-based practice. I'm doing a formative assessment in San Jose Unified Schools right now. The students James and Sarah are so active in making change right now. There's so many opportunities for that. And I would like all of us to do that more in our junior one level.
I did do a reflective question today, and I asked the students in my class this morning, how have you used evidence-based practice in your clinical practice so far? And I have to say, and I'm sure maybe it was at your site, Mary Lou, but one of them said that they were doing, they were working in a homeless housing center, and they had been offering the clientele some just centering and meditative type practices, just to decrease stress. And they said they weren't sure, we've been talking about a lot of that in class and such. So they started to do it with the clients. And unfortunately, they're leaving to go to another facility. And I guess the clients came to them and just said, we're really sad that you're leaving, because this has been so useful for us. We feel, and they said that they could see the clients' faces change over the course of the 2 or 3 sessions they had. So anyway, I mean, when you hear that kind of an experience coming back, I credit, the clinical faculty for what they're doing and for giving the students that, opportunity. And I also credit our theory courses for, kind of stimulating them to even think in that fashion. Because to me, that's a summative experience, when students can take the concepts that we're trying to teach around evidence-based practice and then find something that they think that they can do that's going to improve care, and then do it. I mean,
that's how simple it is, really. It's so simple. If indeed it's not going to the library and finding a new topic, but it's actually implementing into whatever clinical there are. I think that's not even my clinical. I think it could be Carrie Martin's clinical, that they're doing some work with the homeless. There's several people doing a lot of homeless work.
I didn't mean to digress into this.
Well, and that's a perfect example of how the clients themselves are affirming and confirming the difference that it made for them. And that, so it's not even us providing that validation of their learning, but isn't it awesome when their clients and patients are validating that they're making a difference in their lives?
But isn't that the kind of nurse we want to graduate from USF, and like competency 1, 2, 3, 4, and like they're a junior level, whatever that'll be in the future, and implement that as a nurse with their patient.
Right.
That's what I'm saying. You guys are catalysts for change.
God, they are. They are wanting change. That's why these students want to do that work. They are pretty amazing. I feel like that's the greatest gift I have, just being with them. Yeah.
Same.
So formative, I'm here to learn more.
What else?
Anybody else have any ideas or thoughts or questions?
Or learning activities they want to share?
Well, I'm going to just share it with, I have 2 students going to the middle schools. They're going to every middle school in San Jose Unified. And we just started it, but it was very important what they're seeing. Sometimes we think we're really educating the student for what's important. But what they're seeing of how they can make a difference in clinical practice and in evidence-based practice or in mental health, the students are doing an amazing job. They're actually looking at all the posters, actually talking to the students, doing health. Hopefully they'll do a health table. But I think they're learning how to evaluate, how to do not only a community assessment, but actually to do their own evaluation of clinical practice too. So I think that's really important that they have an opportunity to get in there. And I got a little worried. That's where I was today earlier, because I said, you guys, I got to see this. It has to be perfect. I can't have you doing something for 16 schools and presenting it at San Jose Unified unless I know that we're on the right track right now. So unless we're on the right track right now, and I'll just give you an example. I was there at the same time a student came in. The student had fallen on the pickleball court. It wasn't a simple fall. But the girl hadn't eaten, you guys, since the day before. She didn't bring a water bottle in. And all the nurse said to her was, I'm going to phone your parents. It's like, I was there. I couldn't believe it with the 2 students. And the parents said, oh, go get her a hamburger. It wasn't like what was going on. The nurse didn't sit down, but the students knew that these were important things, the interventions of how to communicate with that person. And they were able to call it out. But that was also a place in which a poster said, it's great to be thin. And too bad your other friends aren't thin too. So we're assessing, we're going in, we're assessing the health office and the health office to tell them, what kind of posters are there. And once we have what kind of posters, what kind of issues are students coming into? So really, the girl didn't bring, she hadn't eaten the night before. She ate nothing that whole day. So we're really seeing what really is happening with some of the kids' schools that's going on in our schools. And you don't get there until you have an opportunity. So I think the students learning formative assessment, and then at the end, they're going to put all this data together and do a summative plan of what their recommendations are for mental health. So
That's awesome.
they are awesome. So that's why I wanted to come make sure I was on the right pathway myself.
Yeah, that's a great example.
It is a
Mary
great
Lou.
example.
Mhm.
So I said to them just today, I said, okay, we're not going to change the world a lot, but if you know you can change one person or 2 people at some of these schools, and they can look up to you to say, God, I might like to be a nurse someday like you. Or, and I'm so lucky to have both students that are very human-centered people. So it's a gift, but I just didn't want them thinking. I think that's my whole thing in our community, is that they're not out there by themselves, that we're with them. And I know this is a group I'm going to go to St. Anthony's with them on Holy Thursday, which is the 28th. So the lady says to me, are you going to be there with them? I said, well, yes, I am. Why would I ever send them to a place I wasn't going to be there at the same time with them? Like, you have to reflect on the experience of preparing food for the homeless and clothes. And, I don't know. I get a little worried for all of us sending our students to all these places and not really knowing what they're doing. It's sort of my big thing right now.
Well, it's an important one. Thank you. Thank you, Mary Lou.
Yeah.
Anne.
I wanted to, Miss Nancy, would it be possible to share your share that template
Sure.
so that we're able to, because it makes a lot of sense to kind of have something that breaks down the thought process,
Mhm.
but also my question to the group is how do we bring, I can understand breaking down the process in an EVP class or a leadership class, right? It's not as it's more it's easier to do it there. But how would we do that for a med surg class? A core class in nursing that's very clinically oriented, to break down the thought process. I mean, why am I teaching about acute kidney injury? How do I break that down?
Well, I
What
guess
other ways there to do it other than teaching the pathophys process, the rehab process, the treatment process, and then going into, well, if this isn't solved, if medicine doesn't have an answer, when we get to the last sphere of care, what are the ways that to do that, to break that the thought process down?
Well, the one thing I was thinking about, because I know you have those experts that teach a certain topic, right? You know, each. So that's, to my way of thinking, that's a formative assessment
The
process.
topic champions.
Yes. So that's one that just comes to mind to me. And then I wonder if you were to look at those categories of whatever it is, respiratory or cardiac or whatever, and kind of build learning activities that kind of get to that. So you were talking about, you know, the continuum of care or whatever, and then maybe those again are formative activities that lead to what you want the students to be able to do at the end of, you know, a series of modules or whatever, or at the if there's a paper at the end, or a test, you know, maybe there's a quiz. So maybe if you have, if you need to do a quiz, a short quiz at the end of each module, maybe these formative assessments are learning activities that build to the students being able to learn the content. Does that make sense at all?
That makes sense.
Yeah, and you know what I keep reminding myself, Anne, is it's like we're not here to make sure students, I think we're here to teach students how to think. And can they break down their thinking? And so
Mhm.
if they can apply it in a cardiac, like if some students
Case
apply it in
study.
a cardiac patient, some can do it with a renal patient, some might do it with a pulmonary patient. They don't need to do it with all med surge problems. But I think of your champions, and I would think a deal assignment would be great for that too. If your course is connected to clinical at all, that like if they could interview and describe a patient with a particular illness, and I mean, write the D, and then the examine could say how, you know, what is the pathophysiology, then what is the, you know, all your those where you the creative time is writing the examination questions where they could specific for each one. I'd love to do that with you if you ever need
Yeah.
help to be a thinking partner. And then the articulation of learning comes at the end. And if some of the students were looking at cardiac and some were looking at pulmonary and some were looking at renal and some were looking at endocrine, I think it would be so interesting. But the key is they're all applying the same, thinking about their thinking in the same way.
Mhm. Mhm.
That makes sense.
Yeah.
Thank you.
Yeah.
So
I just
lots of
think we
different ways
learn
to split it.
together.
Yeah.
Yeah.
Mhm. Mhm.
Yeah. Well, we are about out of time. I hope we can continue to radiate energy and generate more folks to come, but as long as they're listening to, we hope you're listening to the recording, and we invite you to come to the next one or whenever it's possible, because we are really invested in learning and growing together. So, Carolina, did you have an announcement?
I sent the evaluation to everyone. Those that are receiving CEs, you need to respond to it. But if you're not, and it's always appreciated if you have any feedback. So it's in the chat. Thank you.
All right, thank you. And Nancy, you're going to be taking the lead on our next. You want to say a little bit about next time?
Yes, next time we're going to be talking about, and help me.
Coaching and
I
mentoring.
just forgot. I'm 1 week ahead of myself.
Coaching and
Mhm.
mentoring.
Coaching, yes. How could I
Coaching,
forget?
mentoring.
Coaching. Teacher is coach. So
Teacher as
Good.
coach. And a lot of you are already doing that, but I think there's a lot of ways that we can reframe our thinking as a coach. What does that mean and how does that show up in our comportment and our behaviors with our students? So
Good.
so we'll
Sorry.
see you in 2 weeks.
Okay.
Thanks.
Thank you.
bye,
Thank
everybody.
Thank you.
Thanks so much for
Sorry.
coming.
Thank you.
Bye-bye, everyone.
Okay.
One word.
Oh, wait, let me stop the recording here.